Our bodies are incredible networks of pathways. These pathways ensure that vital substances reach every single cell. This intricate system is our circulatory system, and at its heart lies a powerful pump, the heart. The heart propels blood, the lifeblood of our bodies, through a complex network of vessels. These vessels are our arteries and veins. Arteries are responsible for carrying oxygen-rich blood away from the heart and delivering it to the tissues. Veins, on the other hand, play an equally crucial role. They act as return channels, collecting deoxygenated blood from the tissues and carrying it back to the heart for replenishment. This continuous loop ensures that our bodies receive the oxygen and nutrients they need to function. Think of veins as the gentle rivers of our circulatory system. They are the vessels that ensure the smooth and steady return of blood to the heart. Unlike the forceful pulsing of arteries, blood flow in veins is more subtle. This makes understanding their structure and characteristics crucial, particularly in healthcare settings where accessing the bloodstream is often necessary. This is where the art and science of IV placement come into play. Intravenous IV therapy allows healthcare professionals to deliver fluids, medications, and nutrients directly into the bloodstream. This method is essential for a wide range of medical treatments, ensuring rapid absorption and targeted delivery. While both arteries and veins are integral parts of our circulatory system, they have distinct characteristics that set them apart. Understanding these differences is paramount when it comes to IV placement. Arteries, the outbound highways of our circulatory system, have thick, muscular walls. These walls can withstand the high pressure of blood being pumped directly from the heart. In contrast, veins have thinner walls and a larger diameter. This difference in structure reflects their role in accommodating a larger volume of blood at a lower pressure. Another key distinction lies in the presence of valves within veins. These valves act like one-way gates, ensuring that blood flows in only one direction, towards the heart. This ingenious mechanism prevents backflow, which is essential for maintaining proper circulation. Arteries, on the other hand, do not possess valves because the high pressure of blood flow naturally prevents backflow. When it comes to IV placement, these structural differences come into sharp focus. The thinner walls and lower pressure within veins make them more suitable for needle insertion. However, their delicate nature also requires a gentle touch and a keen understanding of their anatomical location. The human body is a tapestry of veins, each with its own unique pathway and characteristics. Certain veins are prime real estate for IV placement due to their accessibility, size, and location. The median cubital vein in the elbow is a favorite for its size and stability. The cephalic vein offers another reliable access point with its straight path. The basilic vein is less desirable due to its proximity to the brachial artery and median nerve. The choice of vein depends on factors like patient age, medical history, and IV therapy type. Locating and preparing veins for IV insertion combines anatomical knowledge, visual acuity, and a gentle touch. Gather necessary supplies: gloves, IV catheter, dressing materials, antiseptic solution, tourniquet, and sharps container. Ensure the patient is comfortable and positioned appropriately. Good lighting is paramount. Explain the procedure to the patient to alleviate anxiety. Put on gloves and apply the tourniquet 4 to 6 inches above the IV site. Inspect and palpate the arm for veins. Choose a straight, palpable, and easily movable vein. Cleanse the IV site with antiseptic. Insert the IV catheter bevel up at a 15 to 30 degree angle. Look for a flashback of blood to confirm entry. Section 5. Navigating the rapids. Troubleshooting common IV placement challenges. While IV placement is a routine procedure, it's not without its occasional challenges. Veins, like the waterways they resemble, can sometimes be unpredictable. Here are some common hurdles you might encounter and how to navigate them. Rolling veins. Some veins have a tendency to roll away from the needle. To prevent this, apply gentle traction to the skin below the vein with your non-dominant hand, anchoring it in place. Collapsing veins. Thin-walled veins can collapse when punctured. If this occurs, try using a smaller gauge needle or applying less pressure during insertion. Hydrating the patient beforehand can also help plump up the veins. Infiltration. Infiltration occurs when the IV catheter punctures the vein and fluid leaks into the surrounding tissue. Signs of infiltration include swelling, coolness, and discomfort at the IV site. If infiltration occurs, immediately stop the infusion, remove the catheter, and apply a warm compress to the area. Extravasation. Extravasation is similar to infiltration, but involves the leakage of a vesicant medication, which can cause tissue damage. If extravasation is suspected, stop the infusion immediately, aspirate any residual medication, and administer an antidote if available. Remember, patience and a calm demeanor go a long way in overcoming these challenges. If you encounter difficulty, don't hesitate to seek assistance from a more experienced colleague. On Section 6, precision is key. The importance of proper technique for patient well-being. Mastering the art of IV placement requires more than just anatomical knowledge. It demands a commitment to precision and patient well-being. Every step, from selecting the appropriate vein to securing the catheter, plays a crucial role in ensuring optimal outcomes. Proper technique minimizes the risk of complications, such as infection. Using sterile technique throughout the procedure is paramount in preventing infections. This includes proper hand hygiene, using sterile equipment, and disinfecting the IV site thoroughly. Hematoma. A hematoma is a collection of blood outside of a blood vessel. It can occur if the vein is punctured multiple times or if pressure is not applied to the site after catheter removal. Nerve injury. Nerves often run in close proximity to veins. Inadvertent needle contact with a nerve can cause pain, numbness, or tingling. Choosing the appropriate vein and using a aseptic technique minimizes this risk. Phlebitis. Phlebitis is inflammation of a vein. It can be caused by mechanical irritation from the catheter, chemical irritation from the infused solution, or infection. Using the smallest gauge catheter possible, securing the catheter properly, and monitoring the IV site for signs of inflammation can help prevent phlebitis. By adhering to strict protocols and prioritizing patient comfort, healthcare professionals can ensure that IV therapy remains a safe and effective treatment modality. Section 7. Beyond the needle, mastering IV placement for optimal healthcare. Mastering IV placement extends beyond the technical skills of venipuncture. It requires a holistic approach that encompasses patient communication, empathy, and a commitment to ongoing learning. Effective communication. Patients often experience anxiety related to needles and medical procedures. Taking the time to explain the procedure, address concerns, and provide reassurance can significantly improve the patient's experience. Empathy and compassion. Recognizing that each patient is unique and may have individual needs or anxieties is crucial. A calming presence, a gentle touch, and a willingness to listen can make a world of difference. Continual learning. The field of healthcare is constantly evolving, and IV placement techniques are no exception. Staying abreast of the latest guidelines, best practices, and emerging technologies ensures that healthcare professionals provide the highest standard of care. By embracing a patient-centered approach and striving for excellence, healthcare professionals can transform IV placement from a routine procedure into an opportunity to make a positive impact on patient care. Section 8. A lifetime of learning, the continual pursuit of IV access expertise. The journey to mastering IV placement is an ongoing pursuit. As healthcare professionals encounter diverse patients and clinical scenarios, their skills and knowledge continue to grow. Regular practice on simulators, participation in workshops, and seeking guidance from experienced mentors are invaluable for refining technique and building confidence. Embracing new technologies, such as ultrasound-guided IV placement, can further enhance accuracy and reduce complications. The ability to confidently and competently establish IV access is an essential skill for any healthcare professional involved in patient care. It is a skill that requires dedication, precision, and a genuine desire to provide the best possible outcomes for every patient. By embracing lifelong learning and prioritizing patient well-being, healthcare professionals can truly master the art of IV placement, ensuring that this vital aspect of medical care remains safe, effective, and compassionate.